Well, according to the Nigerian Center for Disease Control and Prevention, there have been over 1,141 suspected cholera cases recorded across 30 states in Nigeria since the 1st of January 2024. Now, cholera, which is highly contagious and waterborne disease, this has claimed over lives of several persons in Lagos, and no fewer than 24 persons have died, with over 400 new infections. In Ogun State, it has also recorded its first death from cholera outbreak, with 5 persons hospitalized. Now, joining us via Zoom from Abuja is the Executive Director, Corporate Accountability and Public Participation, Africa, Kimbode Olufemi. We also have joined us via Zoom, Public Relations Officer of the Association of Public Health Physicians of Nigeria, Dr. Blossom Madufoka. Many thanks for joining us, gentlemen. Well, I learned that our guest from Abuja studio is not there. Well, a very good morning to you. At this time, all right, the numbers are increasing daily. What do you make of these numbers, and how Nigerians can help contain this particular development, talking about cholera outbreak in the country?
Yeah, good morning. From what the CDC has reported to us, this current outbreak started in January, and we are in June. And what we've seen over the past 2 weeks is that the numbers now keep increasing. And in fact, the number of the states with infections also keeps increasing. And that is most worrisome, because you will think that 6 months down the road that the government will have been able to control this. And that, for me, questions this country's epidemic preparedness. We just coming out of the COVID-19 pandemic, and so much was said, so much fora was organized in order to talk about getting prepared for epidemics and, well, God forbid, pandemics. But here we are. The last major cholera outbreak in Nigeria was in 2010, and it killed close to 800 people in the north with over 3,000 infections. It is so sad that Nigeria is still talking about a waterborne disease, a disease that has to do with poor sanitation, crowded communities, and the rest of them. And the basic we were supposed to do, which is to map where this originated from, contain the risk, contain the spread of the disease, it doesn't look as if we are near doing that as of today. And so the figure will probably escalate.
And CAPPA is urging the government to prioritize access to public water. How will this affect the impact, or how will this impact on addressing the cholera outbreak? And when we are talking about public water, we're also talking about ability to maintain it and sustainability.
So we often say that we can't do things same way and expect different results. The first lesson we ought to have taken from the COVID-19 pandemic was that water is usually our first line of defense. When COVID-19 broke, Nigerians were asked to begin to wash their hands. They were asked to begin to wash their faces, and, Similarly, cholera is actually spread through contaminated water or contaminated food. Then again, your first line of defense is to also wash your hands. When you shake people, wash your food, wash that. And we have mentioned the fact that, Nigeria has very acute shortage of public water. About 30% of Nigeria only have access to, pipe-borne water. And we think that after COVID-19, government will escalate, the provision of water for domestic use and our first line of public health defense. Now, when you look at most of our urban communities that cholera, it's, getting, these big figures, particularly Lagos, you go to the markets, you go to certain homes, And you find that those markets will not have water to wash food, to wash vegetables. People are living in poor sanitary conditions. And these are the conditions that expose people to this kind of bacterial infection.
All right, so let's quickly bring in Public Relations Officer, Association of Public Health Physicians of Nigeria, Dr. Blossom Madufoka. Many thanks for joining us on the program, Dr. Madufoka.
Thank you for having me.
All right, you saw the figures. The figures are increasing daily at this time.
Yes.
What do you think the government should be doing to help prevent more death in the country?
So as soon as the outbreak was declared, an emergency response was kicked in. And we've been seeing outbreak investigations going on, environmental sampling, etc. But I'm going to take up from what the last speaker was saying. People don't realize that even in places like London, they had cholera outbreaks, even just in the past century. But how did they curb those outbreaks? They curbed the outbreaks through proper environmental sanitation, provision of clean and safe water, number one. Number two, provision of proper sewage disposal facilities. These are key in ensuring that outbreaks of cholera do not continue to happen in a country like Nigeria. And in the current outbreak, if these facilities are not available, it will be very difficult for us to curb this outbreak or even any future outbreaks. I work with underserved communities in Lagos. I visit slums. I visit a lot of the shanties. It's very, very difficult to ensure that you don't have open defecation in those places. And open defecation, like in a city like Lagos, is one of the things that is driving these outbreaks. So these are fundamental infrastructural issues that need to be handled. If not, it will be difficult to curb these outbreaks when they occur, and it will be difficult to prevent these outbreaks from happening.
And while we are also talking about the role of the government in this, it's also important for individuals to equip themselves with a level of knowledge to be able to, address these issues when they come. Talk to us about the means of transmission. Do we have oral-to-oral transmission? Do we have human-to-human transmission? Or how can this be addressed?
So the ways that cholera can be transmitted, one, through contaminated water. So water that is contaminated with the bacteria that causes cholera. Through contaminated food. For example, you purchase your food products, vegetables, etc. You consume them raw and they're infected with cholera, you can get infected. Another way people can get infected is you touch surfaces that have been infected by the bacteria. People don't realize the bacteria can actually survive in the environment for up to a week. So you touch those surfaces and then you eat with your unwashed hands. That's another way you can get infected. If you're taking care of someone that has the disease, you can get infected if you're not properly washing your hands. Another thing that people don't realize is 80% of people that have cholera don't actually have symptoms. So these individuals can transmit the infection without knowing. So you interact with people, you go and eat, you don't wash your hands, you can get infected. So these are the ways that people can get infected. What can the public do? This is what we say all the time. Cholera is a respecter of persons. It's one disease that respects personal hygiene and proper sanitation. Frequent washing of your hands. If you don't have access to clean water, you can use a hand sanitizer. Ensure that any fruits or food or vegetables that you buy from the market, you wash thoroughly with clean water. If you're unsure, you peel the fruit before you eat, or you parboil your vegetables before you eat. These are some of the things that we can do to protect ourselves. And of course, open defecation is a complete no-no. we should completely abolish that practice.
And what would be the place of vaccination in this? Would it be for prevention or for cure?
Great question. So vaccination is one of the what we call levels of prevention, one of the layers of protection that we have against cholera. So it's called the oral cholera vaccine. It can give you protection for up to 2 years. The problem is this: the oral cholera vaccine is not readily available. So unlike, let's say, your polio vaccine, measles vaccines, oral cholera vaccine is not readily available. So it's not something we can rely on. We try to reserve it for communities or populations that are at high risk of infection, like some healthcare workers or people that are vulnerable. But to have it mass distributed to the entire population, that's not available. So we have to constantly rely on these personal hygiene measures, hand washing, avoiding open defecation, boiling of your water, etc.
All right, very, very interesting development. Let me put you on the pause at the moment. Let me quickly bring in Mr. Akimpode Oluwafemi. She has made mention of open defecation. Let me bring these particular statistics from the 2021 hand washing report. Says that approximately 448 million Nigerians still engage in open defecation, and about 8% still practice hand washing. So are you not bothered about this particular figure of about 48 million Nigerians coming from this report still practice open defecation in the country?
Well, I think every Nigerian should be worried about that. And I made reference to the 2010 outbreak. And it was traced to the fact that there was rain and it actually washed sewage into the rivers that people drink, wash, and perform domestic activities from. And that singular act killed close to 800 Nigerians. I think every public health expert in Nigeria has mentioned the fact that open defecation is a no. Now, sometimes people used to think that, yes, these are, limited problems to maybe the villages and the rest of them. There is the problem of urban slum in Nigeria. And I'll give Lagos, for example. There are so many communities in Lagos that people defecate directly into the waters. And I think this is the reason why government must declare emergency on water and on sanitation. Let me tell you this, that one of the major problems in Nigeria is that there are not even public toilet facilities. You go to markets, you go to several open spaces, and people do not have anywhere to perform nature's call. And what do you expect people to do? They resort to all sorts of things. It's like short throw, all sorts of things that even they do in markets. And you walk by our roads and you see how people defecate through, by the drainages, anywhere available. Ultimately, these are washed back into the water system. Don't forget that less than 30% of the population in that same city had pipe-borne water. A lot of people rely on boreholes, dug boreholes. People dig boreholes. Eventually, it's linked to sewages and the rest of them. So I think this is a national emergency, and the response should be from both the national, the states, and the local levels, and even the local communities. And sometimes I tell people that even government needs to include these in their building plan approvals. You want to build a mall, right? A lot of our leaders do travel. You should specify the number of toilets, washrooms that should be available. You want to erect a building, 3-story building. These are part of what guidelines that the government needs to enforce to ensure that gradually we face this. And of course, we do not take away the most important responsibility of government to provide public toilet facilities. Local government can do that, state government can intervene. Let us use this as a learning curve and begin to take concrete action to stop open defecation once and for all in our country.
Mr. Lufemi, can we also consider the housing deficit that we have in the country? If we have low-cost housing for Nigerians, will that also reduce open defecation in the country?
Yes, absolutely, because most of the high-risk areas are actually where people are living in a very crowded community. They live together, do all sorts of things together. And so all these things have to be taken holistically together to ensure that we begin to reduce the risk of people continuing to contract cholera. And if you don't do this, this will keep recurring in our country.
And this is where conversations around the need for construction of public toilets, sewages, and also awareness on stopping open defecation. What role will awareness play in, improving access of communities, especially to clean water, and also talking to them about the ills of open defecation?
Well, I think communication is a key tool, for preventive medicine. People need to know what action they themselves can be taking up to the community level. I remember when I was in primary school, but these things were taught then in primary school. They teach us about cholera, how you can get infected. So you already know that. We need to take this quickly to the local communities. We need to take it to the people. We need to take it to the villages. As much as possible, we should also use the mass media. I really am not seeing that kind of overwhelming messages going down through the media so that people can...
There have been those kind of messages. We have been trying our best to inform the public about that. When I talk about awareness, I'm talking about the fact that it's not just in rural communities like we think. We had our correspondent, go out last week to speak to people about their awareness, and if they are aware that there is an outbreak. And many persons say they're not aware. This will also bring us to the conversation of self-medication and people underrating some of these illnesses.
Absolutely, you're correct. I think we should also let our people know that once you begin to see those signs, it is not your usual diarrhea that you go and take, some of those stuff that our people take. That this time around, any little sign, and this is extremely important, that you should report yourself to medical facilities. That can't be overstated.
Okay, let me quickly bring in Dr. Blossom here. What are those symptoms that Nigerians should also be looking out for to ensure safety? Because educate Nigerians on some of the symptoms that they should be looking out for when they have cholera.
Okay, very important question. So some of the symptoms that you have for cholera include what we call profuse diarrhea. So what is diarrhea? Diarrhea is passing loose stools 3 or more times a day. However, the diarrhea of cholera is different because it's profuse. It's almost like water. If you've ever seen someone with cholera, it's like water is pouring out of the person. Let me give this example. If you've ever boiled rice and parboiled it and you have to wash it, the first time you wash it, the water that you see is actually what the diarrhea looks like. We actually had to call it rice water stool. So it's very characteristic because it's so much and it happens very, very quickly. Another symptom is vomiting, for example, abdominal pain. But those symptoms may or may not occur. The key symptom is profuse diarrhea. Once you begin to have that kind of diarrhea, you need to get yourself to a healthcare facility as soon as possible because for cholera, it's a race against time. We need to quickly rehydrate that individual because they lose fluid so quickly and they can die within a few hours.
And when these persons present themselves to the hospital, how strong is our medical system to, contain this outbreak in case cases continue to rise?
Yeah, so that's a very important point because The healthcare system is extremely key. We need to have our healthcare workers available. We know that in the past few years, we've had a complete exit of many of our healthcare workers. Many of the colleagues I work with have left the country. Actually, 90% of my classmates don't practice in this country. So we have a dearth of healthcare workers in this country. That's one. Two, the ones that we do have need to be trained on how to treat cholera and as well as other diseases and to handle the cases that we have. In addition, we need to have the materials available to treat the IV fluids, the medications that we need to treat these individuals, even the beds that we need to have, isolation areas that we need to have. These are some of the challenges that we have, but I will tell you that there's a lot of training that has been going on. I had to undergo an infection prevention control training a few weeks ago. So training is going on, but can we do more? I think we can do much more. But even with everything that we can do, I will say that the dearth of healthcare workers is it's a major problem, because rather than one person treating 2 patients, you now have one person, say, treating 10 to 20 patients, and eventually it will impact on the health outcomes of the community.
Malaria now will not be looking out for cholera outbreak, because I had a friend who had malaria and was thinking he had cholera. But we have a doctor here that, well, you're giving us what we need to look out for. But what is the way forward now? Because there's this general saying that cleanliness is next to godliness. How can Lagosians, Nigerians put in this issue of cleanliness into their activities to curtail this cholera outbreak around them?
So, the way forward is there's a role for government to play, but there's also a role for the individual to play.
Right.
So on the part of the individual, it's things like this, communicating with the public. You communicate with the people in your own circle. So we share the message that hand washing, people don't realize hand washing can prevent up to 70% of infectious diseases. Hand washing is key. If you don't have access to clean water, you can use a hand sanitizer. Make sure you boil your water as much as possible. If you can't boil your water, there are chlorine tablets that you can put in your water and can disinfect your water if you wait for it for like 30 minutes. So these are some of the simple things that we can do on an individual level. Yes, we need to do much more at the level of the government provision of clean water, sanitation facilities, but we can also start individually to make changes in our own personal spaces.
All right, so it's a fine place to leave it. Public Relations Officer Association of Public Health Physicians of Nigeria, Dr. Blossom Madufuka. Many thanks for joining us on the program this morning.
Thank you for having me. My pleasure.
Executive Director, Corporate Accountability Africa, Akimbode Olufemi. Many thanks for having you on the program this morning.
Thank you, sir.